to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. Welcome to Ask the Patient Advocate podcast, where we discuss all things related to navigating your health. Today, we're discussing a rare and challenging cancer called cholangiocarcinoma, also known as bile duct cancer. It's a diagnosis that no one wants to hear, and it can be especially daunting due to its rarity and poor prognosis. We will explore the challenges related to navigating this condition and highlight how pathway patient advocates can provide crucial support for patients and families dealing with this diagnosis. Joining me today is Christine, who is a member of our team. So welcome, Christine. How are you doing today?
Hi, Dr. Borelli. How are you? I'm good.
Good. Great. I'm really happy that you're on today so we can discuss this important topic.
Yeah. So I'm not sure all of our listeners know about cholangiocarcinoma because it's a rare cancer, and it's not only rare, but it is also extremely aggressive, right? So often caught in advanced stages. The American Cancer Society reports around 8,000 new cases in the US annually, with a median survival rate of just 6 months.
So am I.
So, one of the biggest challenges with rare cancers like cholangiocarcinoma is the lack of data and experienced providers, especially locally to where you may live. Right? So, being so rare, many doctors, including oncologists, may not have encountered this type of cancer before.
I can recall a particularly challenging case where my own brother, at just 41 years old, was diagnosed with cholangiocarcinoma. The news was devastating, especially since it occurs mostly in patients that are a little older, um, though it can occur at any age, of course. And it's still very difficult to talk about because this brings up so many terrible memories. But that being said, it's important for me to talk about it on this podcast because I want to make sure that the story is shared, so to hopefully help similar people in situations like this. And even with him, just getting to the diagnosis was such a challenge. It was misdiagnosed by multiple hospitals, and the diagnosis was delayed for several months because of that. So just getting to the diagnosis was a challenge in itself. And then, um, even with me working as a healthcare provider at the time as well, there was still so many roadblocks that occurred even after we had the diagnosis. So initially, we were told that he had about 4 weeks to live when the diagnosis was made.
Oh
Yes.
no.
And that was 7 years ago. And thankfully, my brother is still alive and living life. And I'm very grateful for that.
Yeah.
While there continues to be many challenges with navigating his health, including insurance authorization approvals and, challenges when he changes like medication regimens and things like that. He has a great healthcare team that he trusts now, and he's alive. He's able to enjoy his family, yes, thankfully, and life. And so I am beyond grateful for that. And I think this is a story that many of our clients or potentially future clients can really relate to.
Yeah. So thinking back, what are some things that you did that you felt were key to help him to get to where he is today?
So, in situations like this, it's so crucial to seek expertise. In this situation, I insisted on consulting with a surgical team, despite being initially told that surgery was not an option. I did some research and contacted some colleagues, and I understood that there was a small potential for a surgical intervention. This insistence made a world of difference as the surgeon was actually able to successfully remove the tumor and giving my brother essentially like a new lease on life.
Nice. So even though the doctor said that there was nothing they could do, you were able to push for more opinions, get more information, and explored every possible option.
Exactly. It is so important to get multiple opinions and have someone do appropriate research, especially in situations like this. This story highlights the importance of asking questions and seeking multiple opinions, especially if you have a atypical condition. I mean, this could be a valid statement for any condition, but especially when it's rare because there's less people that are experienced in it. My role as a private patient advocate is to ensure that all possible avenues are explored and the best care options are pursued. One thing I did learn from this experience is that it's difficult to advocate for your own family. And I often discuss this with their clients. There is a great benefit of having an external advocate that is well knowledgeable, experienced, and one that can earn your trust and that you have this trusting relationship where they are navigating your care. And that's so important, being involved emotionally as a family member or yourself going through it. It's very difficult to best advocate because you have that emotional and personal attachment. So it's really, really important to seek a patient advocate that will help you, a private patient advocate. Another challenge that patients with rare diseases face is navigating the healthcare system and securing appointments with the right specialists. For our clients, we often coordinate care by securing referrals, scheduling appointments, and ensuring that all the necessary medical records are available. In my brother's case specifically, the process of securing a surgical consultation was critical. And after being initially dismissed by an intern, we persisted, asking for a surgical evaluation. And this persistence thankfully led to a surgical consult and then ultimately a successful surgery. And I will tell you that at that point, my relationship was a little bit different because I wasn't just the patient advocate, I was also the family member. And that's kind of where it gets a little bit, sticky in certain situations like that. But my brother at the time was very reluctant to ask for um, the surgical consultation because she was like, well, I was already told no. The intern told me no. And I was like, you could still ask for it. And I think not understanding the ins and outs of how the medical hierarchy and the system works and all like in that, it's very intimidating, I guess is a good word to say, where they don't want to push because then they think maybe like, oh, I'm not going to get any care. Or they're going to be mad at me if I ask for it. But you definitely have that right to ask and ask any question that you want to ask and, pursue things that you really feel that are unsettled or maybe
Yeah.
not properly, or if you feel that you are not receiving an appropriate answer to your question where you still feel like unsettled, like your answer wasn't a proper answer wasn't given to answer your question, I highly recommend that you ask again or ask for someone else because you have that right for sure.
Yeah. And it's totally okay to ask. Like it's free to ask.
Exactly.
Right. Yeah. Um, so yeah, and it's not uncommon for patients to struggle with understanding medical hierarchy and the importance of seeing the right specialist, right?
Exactly.
So as pathway patient advocates, we help bridge that gap by educating our clients and ensuring that they get access to the right medical professional.
Absolutely. So, in the case of my brothers, understanding the difference between an intern, an attending physician, a specialist, and so forth was so critical. We made sure that the attending physician was aware of the request for the surgical consults, which ultimately led to the life saving surgery. This scenario really underscores the importance of a private patient advocate to help ensure comprehensive and timely care. In addition, 1 year later, unfortunately, the cancer returned, and the local oncologist that we were seeing said that there was nothing that could be done. And he literally walked out of the room. It was, I unfortunately still remember this scenario very vividly. So, 6 months prior, despite having asked for 2 months of continued surveillance scans, which was previously the protocol that we were following. The oncologist had said, "No need. Let's just wait 6 months for the next scan. There's nothing. There's nothing here. So that's what we should do, and it doesn't matter." And he was pretty dismissive of our concern about um, the delayed scans, but at the time we
Yeah.
followed his plan. Well, unfortunately, that plan did not turn out so well. Um, the oncologist was really known for his reputation for treating many well known cases of similar cancers. Without much explanation of why he was making that decision, we kind of just trusted his decision. And at that 6 month visit, he walked in and said, "Well, there's a lot more masses now, and there's really nothing we can do." And he says, "I got to go now." And he walked out of the room. It was so disappointing. He actually was called back in the room, and my brother had asked, "Well, what does that mean for me?" And he basically told him, "Well, you probably have a few weeks left to live." That was it. The oncologist said there's nothing more you could offer, and he just left. It was such a disappointment. It's like we had so many questions. It
For
was
sure.
partially shocked. I
Yeah.
just couldn't wrap my head around how this was like a normal, visit
I
process. Like,
know.
how many other people have been in situations like this? Like, you wouldn't think, especially in America, that something like this would happen, but it
I
happens more
know.
often than you think. So despite this, leaving that appointment was a very shocking time. I mean, there was really so many different emotions going on through everyone's head. So I decided to continue to research, and I found a very successful clinical trial that had been completed recently, where a targeted treatment had successfully managed the same exact cancer in the participants. The clinical oncologist that was responsible for conducting this trial had just presented these findings internationally, and it was very well received. So, after more research, I learned that he was very, very specialized in treating and conducting ongoing research specifically in cholangiocarcinoma. The next challenge faced was trying to arrange an appointment to get him to see this highly specialized out of state oncologist. And so, in many situations, if you find a specialist, which we help with a lot, then the next step is like, how are we going to, in a timely manner, get an appointment with this person? Because a lot of people want appointments with this person. And so it's kind of like, how are we able to physically, make this happen? What barriers are involved in getting this appointment set, things like that. And it really depends on each client, of course. Fortunately, in this case, through some of my contacts, I was able to connect with the oncologist directly. And he actually was amazing. He arranged an immediate appointment. And within 5 days, my brother's prognosis changed from, "Oh, you have a few weeks left to live," to, "You have the ability to live a long life and manage this cancer similar to any other chronic disease."
That's amazing.
It was amazing. It was a
Yeah.
whirlwind. I mean, of course, this is not always the outcome, but for us, it was very fortunate. And I can only imagine how that information changes a person's life. Today, I continue to be so thankful for having connected with this oncologist and his team. And over the years, continued challenges, of course, have presented, but we have been, and I'm confident that we'll continue to be able to overcome them as they come. And I think that's really important. There's always the unknown, of course. We're never sure of what the outcome will be. But I think there's definitely a peace of mind of knowing that you did try adequate research, you had the adequate education, so you did make the best decision. And so that there's no kind of second guessing and things like that. I think that's so important when it comes to yourself or even like a loved one as well.
Yeah. You know what? I'm sure your brother is really grateful for you because without your persistence, of getting him the right care, looking for a second opinion, he wouldn't get this much progress, to be honest, right?
Yeah. Oh, thank you. Thank you. For me, I just see him as very strong through it all.
Yeah.
And it's really amazing as I go through these journeys with clients to see, and you can agree to that, I'm sure,
Yeah, yeah.
Christine, is just kind of seeing how they are able to manage so much and how supportive a lot of times their family situation or their loved one is, and sometimes they don't have that support and sometimes they
Yeah.
do, but every situation is so different. And it is like a privilege to be able to have them trust us to go
I
through this
know.
journey with them.
Yeah.
It really is. So over the years, I have worked as a private patient advocate with clients who were diagnosed with cholangiocarcinoma or similar rare conditions. I always think back to my own personal experience being a family member in the situation. And it really helps me to understand what the client and family members may be going through. Receiving a diagnosis like a cholangiocarcinoma can be overwhelming, not just for the patient, but for the entire family.
Right.
At Pathway Patient Advocates, we provide not only logistical support, but also emotional and informational support. We guide the families through every step, from understanding the diagnosis to exploring treatment options and managing side effects and things like that. And of course, we work with the care teams as
Yeah.
well. We definitely don't take the role of their providers by any means, but we really work together with them to make it a smooth process for everybody.
Yeah, you're totally right. So we also connect patients with viable resources such as the Cholangiocarcinoma Foundation, which offers support and up-to-date information on new treatments and clinical trials. So our goal is to empower patients and their families with knowledge and support, making the journey less daunting.
Also, most importantly, you don't have to feel isolated, like you're going through a process uneducated or alone. For my brother, having access to these resources and a dedicated support team was invaluable. It allowed him to focus on his recovery and enjoy quality time with his family. And thankfully, he continues to do that. A key takeaway from this experience is never to hesitate to ask questions and seek second opinions. Even when a diagnosis seems grim, there may be options available that are not immediately apparent. As a private patient advocate, we are here to ensure that every option is explored and that patients receive the best possible care. Cholangiocarcinoma is a challenging diagnosis, but with the right support, patients and their families can navigate this journey with hope and more confidence. I really truly believe that. At Pathway Patient Advocates, we are committed to providing comprehensive, personalized support. If you or a loved one are dealing with a rare condition or need assistance navigating the healthcare system, please reach out to us. Together, we can make this journey much more manageable. So, thank you so much for joining us today on Ask the Patient Advocate podcast. Looking forward to next week. Have a great week, everyone. If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.